Hey everyone, welcome back to the channel. I hope you're doing well. Today, we're diving into a sensitive and important topic, one that many people hesitate to discuss, but it's incredibly valuable to understand, especially when it comes to the care of our elderly loved ones. In this video, we're going to talk about 7 signs elderly people might show a year before they pass away. Now, before we dive in, I want to acknowledge that this topic can be hard to approach. We don't always want to face the reality of the aging process or the eventual passing of those we care about. But knowledge is power. Understanding these signs can help us support our loved ones in a way that shows kindness, compassion, and respect for their journey. It can also give us time to emotionally prepare ourselves and take necessary steps to ensure that they're receiving the best care possible during this time. It's important to remember that not every elderly person will show all of these signs, and even if some of these signs are present, it doesn't mean that the end is imminent. Every person's journey is different, and these signs can vary widely in each individual. However, being aware of them can help us provide better care and help us better understand what's happening when the body begins to naturally decline. If you notice any of these signs in someone you love, make sure to reach out to their healthcare provider. A doctor can give you the most accurate advice and help address any concerns you may have. With that said, let's get into the 7 signs. The first sign we're going to talk about is unexplained weight loss. Now, we all know that as we age, our metabolism changes, and weight gain or loss can happen for various reasons. However, when there's unexplained weight loss that isn't tied to a change in diet or exercise, it can be a red flag. Unexplained weight loss can point to serious health issues, like cancer, thyroid problems, digestive issues, or even heart disease. When the body starts to lose weight rapidly without any clear explanation, it may also indicate that the body is beginning to shut down in certain ways. This happens when the body begins conserving energy as it prepares for the final stages of life. Weight loss can also lead to weakened immunity, making elderly individuals more vulnerable to infections. So, if you notice someone losing weight despite not changing their eating habits or exercise routine, it's definitely worth getting a thorough checkup with their doctor. Early detection can lead to more effective treatments, so it's important not to ignore this sign, even if it seems small. Weight loss often presents itself several months before the end, so identifying it early on can allow for a better approach to care and provide more comfort during the last months. The second sign is withdrawal and a sudden loss of interest in activities they once enjoyed. We all know how important social interactions and hobbies are in our lives, so when someone starts to pull away from their usual activities or stops engaging with others, it can be a signal that something deeper is going on. Many elderly people experience depression as they age, and this can sometimes cause them to isolate themselves. This withdrawal from social activities is often a sign of depression, but it can also indicate that the person is feeling physically weaker or is simply not able to do things they once loved. Imagine someone who used to enjoy playing cards with friends, gardening, or going on walks suddenly shows no interest in those things. That's a key sign that something might be wrong. If the person seems to be distancing themselves from everything they once found fulfilling, it's a good idea to approach them with care and compassion. It's important not to push them, but instead, provide a supportive and understanding environment where they feel safe to open up. Sometimes, the person may just need a little nudge to re-engage with their loved ones, but in other cases, this withdrawal can be an indication that their body is slowing down in a way that makes these activities feel too taxing. Next, we have increased fatigue and exhaustion. Now, feeling tired as we age is normal, but there's a big difference between just feeling tired after a long day and experiencing a constant sense of exhaustion that doesn't go away, no matter how much rest the person gets. When someone is nearing the end of life, their body begins to conserve energy, and this can lead to extreme fatigue. This isn't just feeling tired, it's a deep, overwhelming exhaustion that doesn't seem to improve with rest or sleep. In addition to being a normal sign of aging, this fatigue could also be related to underlying health conditions like heart disease, kidney failure, or other organ issues. If someone is struggling to get out of bed in the morning, or they seem to sleep most of the day away, this could be an indication that the body is starting to shut down. It's worth mentioning that extreme fatigue can sometimes lead to depression as well, which can compound the issue. When this sign presents itself, it's important to consult a healthcare professional to determine whether the fatigue is simply a result of aging or if it's related to a medical condition that needs attention. Moving on to the next sign, difficulty breathing or shortness of breath. This is another common sign that often gets overlooked. As we age, our lung capacity and heart function can decline. But when someone experiences consistent shortness of breath or finds it difficult to catch their breath even while resting, it can be an alarming sign. Difficulty breathing may be linked to serious conditions like chronic obstructive pulmonary disease, COPD, heart failure, or even lung cancer. When the body starts to experience trouble with breathing, it often leads to anxiety. The person may begin to feel fearful because they can't take deep breaths or catch their breath, which only worsens the issue. If someone is showing signs of labored breathing, or they seem to struggle more than usual when walking or even just sitting up, it's essential to talk to a healthcare provider. There are treatments available that can help ease the discomfort, and in some cases, it could be a sign that the body is nearing its final stages. Next up, we have changes in sleep patterns. Sleep is something that's incredibly important to all of us, but as we age, it's normal for our sleep patterns to shift. However, significant changes in sleep habits, such as excessive sleep or insomnia, can be a sign that something is amiss. Some elderly people may begin sleeping much more than usual, often sleeping through the day and staying awake at night. Others may find it difficult to fall asleep or stay asleep, waking up multiple times throughout the night or experiencing vivid dreams or nightmares. Disrupted sleep can be a side effect of medication, a response to physical discomfort, or simply a result of the body's natural decline. However, if these changes happen suddenly and consistently, it can be a sign that the body is preparing for its final stages. Additionally, sleep disturbances can often be linked to cognitive decline or other health issues. So if you notice your loved one experiencing these issues, it's important to consult their doctor to rule out any serious causes. Now, let's talk about decreased mobility and weakness. While it's natural for people to lose some strength as they age, a noticeable decrease in mobility and muscle strength can be a sign of more serious health issues. If someone is having trouble walking, standing up from a chair, or performing basic movements, it's worth looking into further. This decline in mobility could be a result of muscle atrophy, neurological problems, or even organ failure. When the body begins to weaken, it can lead to difficulty with basic tasks that were once easy. A person who was once able to walk across the room without assistance might find themselves needing help with even small movements. This can be a major sign that their body is shutting down. If you notice someone becoming more frail, it's crucial to ensure they're getting the proper care and attention. Weakness can also contribute to falls, which can be dangerous, so make sure their environment is safe and accessible. Finally, we reach changes in mental state. Cognitive changes, including confusion, forgetfulness, or even hallucinations, are often seen in the elderly, particularly as they approach the end of life. These changes can occur because of the natural decline of brain function, but they can also be a sign of underlying health issues such as a stroke, a brain tumor, or other neurological conditions. If an elderly person starts becoming disoriented, forgetful, or confused about familiar things or people, it could be a sign that their body is nearing the end. It's important to keep a close eye on these changes and make sure their healthcare provider is aware, as certain medications or treatments can help manage these symptoms. It's also crucial to keep the person as comfortable as possible and ensure that they are not in distress. Now, these signs may seem a bit alarming, but it's important to remember that they don't necessarily guarantee the end is near. Everyone's experience is unique, and these signs can simply be part of the natural process of aging. That being said, being aware of these changes and noticing them early can help us provide better care and give our loved ones the dignity and comfort they deserve during their final stages. If you notice any of these signs in someone you care about, make sure to reach out to their healthcare provider for guidance and support.